Vaccinate or not to vaccinate? That is a question that every parent faces when they are having a child. Immunizations are a very controversial issue. It is a subject that evokes strong emotions and usually stirs up a heated debate about their efficiency, reliability, and their safety. Doctors tell us they are safe, but a lot of parents do not believe that and do not know what their child is getting the vaccine for. They simply say they give their child immunizations to keep them healthy, while others say they do not give them to their children due to the adverse side effects that they heard immunizations give. Parents who choose not to vaccinate their children may also do so because of spiritual or religious beliefs, or because that they heard the vaccines are linked to autism or ADHD, even though there has been no medical proof of that, according to the article, should any vaccines be required in children. Most states require mandatory up-to-date vaccinations before a child can enter daycare or school. While this is true, each state carries its own laws. Each state offers its own exemptions, which may include medical, religious, or personal objections. Some states do not require parents to give a reason at all as to why they refuse to have their child immunized. There are no federal regulations regarding vaccines. In 2010, it was reported that 93.4% of parents did immunize their children despite all the noise against this. This is according to an article written by Kennedy in 2011. All major health organizations recommend that infants and children should be vaccinated against the 15 communicable diseases. Examples of these diseases are measles, mumps, rubella, meningitis, chickenpox, pneumonia, flu, and the newest one, HPV. HPV stands for the human papillomavirus. This is a virus that can cause cervical cancer in women. But they are also now giving this vaccine to teenage males because they believe that they are carriers of HPV, and when they have unprotected intercourse with a female, they may give the HPV disease to the female that they had unprotected sex with. By age 6, most children should be given 29 vaccines. These vaccines can be multiples of the same one according to a schedule made by the CDC. Many people believe that they should be mandatory because no individual should risk the lives of others for the sole purpose of satisfying their moral, religious, or political beliefs. This is also according to the article, Should Any Vaccines Be Required for Children, written in 2014. This is especially seen to be right because researchers at the Pediatric Academic Society state childhood vaccinations in the United States prevent 10.5 million cases of infectious disease and 30,000 deaths a year. Vaccines not only protect the person receiving them, but they also protect the people around them. When a person is given a vaccine, they are protected against the disease before it starts. This is why vaccines are vital to public health. A child cannot decide for itself whether they should have the vaccine or not. This is why their parents' decision is so vital. 31% of parents believe they should have the right to refuse the mandated school entry vaccines. They believe that they are unnecessary and that the threat to others is small and a child's immune system can fight off whatever infection is given. They also believe that forcing them to vaccinate their children violates their First Amendment rights and interferes with the natural law and God's plan for humanity. They also believe that they are linked to ADHD and autism because they can cause inflammation in the brain. Many parents believe that vaccines are just given to generate money for the government. It has been shown that the American Academy of Pediatrics receives a big financial gain from vaccine promotion. I myself believe that vaccines should be mandatory. Why should my child have to be put in harm's way because another parent doesn't believe in vaccinating their child? The links to autism and ADHD have never been proven. Some children may suffer adverse effects of the vaccination, such as redness at the injection site, a slight fever, some pain, which all can be controlled by giving the child Tylenol or Advil before or after the immunization is given. People say we haven't seen the disease the vaccines were made to prevent in a long time. Well, guess what? At Ohio State, the cases of measles and mumps has increased tenfold in the past year. This is because they are saying that many of the international students who haven't been vaccinated against the measles and mumps are coming to Ohio State, and they are now giving measles and mumps to the other students who attend Ohio State. My answer to that is they haven't been around because parents haven't been vaccinating their children against the diseases. They are not saying why this outbreak in Ohio State began, but the feeling is because many of the students did not have the mandatory vaccines. Obviously, the state-by-state rulings are not working. Parents are also not being punished for not giving their children the vaccines. Mandatory means mandatory, not deciding, well, today I don't want them to be vaccinated. Working in my doctor's office, I see patients refuse to get vaccinated. They sign a form stating they are refusing the vaccine for their child. That is it. I have given many vaccines to children in the past 5 years. We have never had a serious reaction to the vaccine. We have never had a child diagnosed with ADHD or autism due to a vaccine. The rare adverse effect we do have is swelling or redness at the injection site. When this happens, we can file an adverse reaction sheet with the county that the vaccine was given in. This paper contains the lot number of the vaccine that was given so that the reaction can be reported to the manufacturer. We have never heard of a case where more than one reaction was reported for a lot. When there is a documented evidence that a vaccine can cause other major health issues, then maybe my view will change. But right now I have seen the diseases at bay because vaccines are given. I do not feel my child's immune system is strong enough to fight any disease without help. So, to immunize or to not immunize, that is the debate. Should we immunize to help many, or should we not immunize a child due to our beliefs? What do you think?